Family Care Visiting Nurse and Home Care Agency provides all sorts of professional services in the comfort of a patient's home, including psychiatric care. Here to tell us more about that is David Engel, as a registered nurse. Welcome, David. It's great to have you.
Good morning, Jocelyn. Good to see you.
When you think about psychiatric care, you really don't hear about home care.
Well, this is true, but this seems to be what's going on in our society. Many patients are the last to hear about what treatments are available to them. Studies have shown that patients actually do much better recovering at home, unless they're a chronic psychiatric patient. In my past history, patients I've talked to in the hospital and nursing homes, 99% of them want to be at home. They always want to go home. The studies have proven that the patients actually do as well at home as they do in the hospital.
And mental health, obviously, we all know it's a big concern here in our country, costing us billions.
Well, this is why we're trying to promote, and the society is trying to promote, in-home services. The medical field is changing, society is changing, insurance protocols are changing. All too often, every treatment comes down to economics, and it's much more economical to treat the patient in their own house where they feel comfortable.
You actually go to these homes and treat the patients. What are you hearing from folks when you go visit them and care for them at home?
Well, we hear all sorts of, I won't say complaints, but suggestions. They want more care. They don't talk to their doctor enough. They don't hear from the doctor. They think that their insurance company should provide them with more care. They expect more care. But the overall thing that I see is they're just excited and enchanted to have a nurse come into their house. And they can actually plan their day around that and make other arrangements when they know that we're coming.
Absolutely. And it's really that individual care. I mean, they want to know that somebody is here to help them and cares about them.
And we do, and that's why we're there. And it's one-on-one, and some people we see many times during the week. Sometimes, on the other hand, some patients we only see once a month.
Let's talk about some of the programs you do offer. Psychiatric case management. What does that all entail?
That entails, on one level, we have specialized APRN nurses. They are the first one to go in and interview the patient, talk to the patient, the psychiatric patient, and they manage the case for that patient if it is a more intense case. They set up parameters, they do nursing diagnoses, they set up a plan of care, and they are in charge actually of our entire psychiatric nursing program.
What kind of illnesses are you talking about here? Can you describe some what patients are dealing with?
Right, we have a varied population, both the children and adolescents. Most of the problems we find in that population are attention deficit disorder with hyperactivity. The children are autistic quite often with disabilities that go along with that. It's called comorbidity. There's 2 or 3 or 4 maybe problems, disabilities that the children have.
What about among adults?
The adults, quite often it's basically personality disorders. There is schizophrenia, bipolar problems, depression problems.
So you really deal with a varied number of illnesses.
And there's many more than that. The list is endless, and we're finding new treatments and new diseases just constantly.
Now, so you also have a psychiatric consultation for case managed by non-psych nurses.
Right. Our specialized APRN nurses, as I said, they take care of the more difficult cases.
Okay.
The intermittent episodic cases are given to the non-psych nurses, and that would be most of our nurses are non-psych, but we all have experience, we've all had training. Most of the nurses at Family Care, I'm glad to see, are very experienced in the hospitals and in the nursing homes. And if you come to our organization fresh out of college, we tell you to get your experience there first and then come see us sometime later.
So when you make these nursing evaluations, what do you look at?
We look at the patient as a whole. We go in and determine what their disease is, or diseases, how they're coping with it, how they're not coping with it. We want to see how high their distress level is at the present. If they've just come out of inpatient service, sometimes they have been over-medicated and kind of tough to deal with it sometimes.
You talk about over-medication. Medication management, I'm sure, is part of also what you offer.
Medication management is a big part of what we offer, and in this litigious society, it's a very important thing. We don't put it in the hands of anyone but the registered nurses. We go in, we help the patients with their medications, we organize them, we put them in day planners that the patient can learn eventually.
Do you find that the patients are generally overwhelmed by what it is that they have to take?
Quite often they are, but that's part of our teaching process, is to narrow it down and give them a sense of security and encouragement. And we really do a lot of counseling in the houses with the patient, but they come along for the most part. Part of our job too is to remind the client to take their medicine.
Absolutely.
Quite often they forget, or they're too tired, or they didn't think about it. And this is just a continual problem for us and the doctors.
You really emphasize that medication, that they need to take their medication to feel better.
That's the basis of feeling better. That's the basis of why they were put in a long-term care center, perhaps, is the medication. We found that most patients, unless they have a major, severe diagnostic problem, do very well on their medication. And we don't often hear about that. We kind of pigeonhole some of these patients in a way that we shouldn't.
You also have this collaboration with this community treatment team.
Yes. There's so much that the community actually they're not aware of, and the patient's not aware. There's community research going on, there's community treatment centers. There's organizations that will also come to the house. Whatever population questions that we have or the patient have, there are all sorts of resources out there that we can collaborate with.
And resources that a lot of people don't know about, but if they want more information, all they have to do is go to Family Care Visiting Nurse and Home Care Agency and their website, as well as call that 800 line, 1-800-946-6331. Thanks so much for being here with me.
Thank you, Jocelyn. It's good to see you
Great
again.
information.
God bless you.